Welcome to Bounce Around Charleston. I'm Randolph Miller. Coming up on today's show, October is National Breast Cancer Awareness Month, and one of the greatest challenges for those who have been newly diagnosed is finding sources of support. Patients are eager for information on making sense of the complex world of breast cancer. We will talk with Lucy Spears, Mission Programs Manager for Komen Lowcountry, and she'll explain ways women can take an active role in their breast health. And join Living Roots Magazine for Sister Summit. This event promises an empowering weekend that will educate and inspire while celebrating women of color. Deanna Smith will be here to tell us all about it. And DF Enterprise presents their second annual talent and fashion show, benefiting the Charleston community. Bounce Around Charleston's reporter Michelle Lemon will join us later with the story. And you don't want to miss our special musical guest. He has won Charleston's Acoustic Throwdown 2 years in a row, played over 1,200 shows over the last 4 years, 2,000 shows in the last 7 years, and has traveled as far as Costa Rica and as far north as Alaska. We'll have singer and guitarist Jameson to perform for us here later on the show. And here with me now, Lucy Spears. Great. Welcome to Bounce Around Charleston.
Thanks, great to be here.
National Breast Cancer Awareness Month. What should we know about this month?
You know, for me, it all is summed up by one thing, and that's know your risk. We want women and men, because yes, men can get breast cancer.
Men also.
Men also, to know that they need to know their bodies, and they need to ask questions.
What would a man do to check?
Honestly, it's exactly what a woman would do. Now, we have learned that statistically, breast self-exam, doing it exactly the right way every time of the month isn't the answer.
Okay.
The trick is to know what is normal for you. If you feel something different in your chest or your breast, it should be checked out and you should get an answer. And if you're not comfortable with the answer, get a second opinion. Ask your doctor for, real proof that this is not a cancer. It rarely is, but I was someone who had a lump for 2 years and had been told for 2 years not to worry about it, and it was invasive breast cancer. So it is all about knowing what's normal for you, getting it checked out, and acting on it.
So it would be okay to have a second opinion? It's
great to have a second opinion. It really is. That's something that I would say for really every medical piece. You know, when you're facing a chronic illness or something that's potentially a fatal disease, why not get a second opinion?
Okay. Now, is breast cancer more prevalent among African American women or?
You know, that's a really interesting question. What we know is that the incidence, which is women who've been diagnosed with breast cancer, Caucasian women are more likely to be diagnosed than African American women. However, African American are much more likely to die from the disease than the Caucasian women. We don't know. There are a couple factors. It may be that they're not getting screened appropriately. It may be not getting appropriate treatment. One thing we do know is for particularly young African American women, it's often a different type of breast cancer, much more difficult to treat, and often starts and is found when the women are under 40, so they haven't even started getting routine mammograms yet.
So what is the Komen Lowcountry? We
are a breast cancer foundation, and we truly are here to help. We have the Race for the Cure on October 20th, which is our main fundraiser, but that supports our mission and grants programs. We provide grants to nonprofits within our service area. There are 17 counties that we serve. So the money that's raised here locally stays local. 25% goes to research, but the 75% stays here. And that funds screening programs, education programs, diagnostic programs, and then help with other things such as transportation or childcare for people who have that need.
Can organizations like churches and social organizations have screenings done at a particular site?
They can, and that's part of the grants process. They would need to partner up with a hospital, because we firmly believe that if you're going to be doing screening, you must have in place a way for women to get treatment. So we are not going to let a woman go unserved. In a situation like that, you would contact Roper Hospital or MUSC or one of our other great hospitals, partner with them. But a church can certainly apply for a grant for a specific event, and a mobile mammography unit might be part of that event, and it might be referring patients to a physical site for a hospital.
I asked that question because sometimes many churches have what you call health fairs. And at the health fair, they will invite different hospitals and different people to come in to educate people on different subjects.
Right.
So I just thought that would probably be something that churches may want to get involved in.
Definitely. And they need to hook up with a good, reputable, and of course Charleston has plenty. We've got some great hospital systems here, and they just need to make sure that all those pieces are in place so that if you're providing a service, you can make sure that the woman gets, or the man gets, everything they need should there be a diagnosis.
So are there any events or anything happening this month that we need to know about?
Oh no, it's just pink. No, no. We've got the Race for the Cure on October 20th, and online registration is open through October 17th at noon, and then people can register on the 19th and the morning of the race to participate. And we've also got Worship in Pink, which is our educational outreach program to the faith-based community, where we literally provide all the materials free of charge to those registered churches so that they can help spread the message.
So who would the churches call to get the information?
Simply go to our website, which is KomenLowcountry.org, and click on the Worship in Pink button, and then right there are all the pieces that you can literally download and print off yourself. We've unfortunately had to cut off the registration back in August so that we could order materials, but anyone can go to the website and download and print their own materials and hopefully register to participate for next year.
Educate your people.
Exactly.
And I think that's the key element here. We need to educate ourselves on everything that's happening in our community.
We do.
Well, we want to thank you for being here today and Bounce Around Charleston.
Great to be here.
And this is National Breast Cancer Awareness Month. Pink is the color.
Think pink.
Thank you, Lucy, for being here today. Coming up, this event promises an empowering weekend that will educate and inspire while celebrating women of color. Deanna Smith from the Sister Summit is coming up next to tell us all about it.